to answer the question, what goes in a treatment plan, we first actually have to ask, why do we need one? And no, I promise you it isn't just to add more paperwork and annoy you. Hi, I'm Dr. Maelisa McCaffrey, founder of the free private practice paperwork crash course, and today we are going to outline exactly what needs to go in a mental health treatment plan. I'm also going to share with you lots of examples that you can use immediately. Okay, so first of all, treatment plans should answer these two questions. Number one, what does therapy with you look like? And number two, how do your clients improve over time? So honestly, I recommend you pause this video, stop right now, and actually consider the answers to those two questions. Because really, those are things we should be able to answer to any client or any person if they asked. Okay, now more practically, how do we actually spell that out in a treatment plan? Okay, now one big caveat here. What I'm about to share does not necessarily apply to Medicare or Medicaid. Those are two US government health insurers, and they often have really specific requirements. So what we're going to talk about today applies to most private insurance and anyone else who is not having to worry about Medicare or Medicaid. So for most of you, if you're a therapist or a counselor in private practice, you're good to go with this video. So the first thing you need in a treatment plan is goals, right? Treatment goals. Now, goals honestly require their own video, so you're gonna get that. I am gonna share another video next week that will outline the two goals every treatment plan needs to have. So stay tuned for that one. The next thing your treatment plan needs is interventions. Now, interventions are what you do in therapy to help your clients. And it's okay to keep these fairly broad. You don't have to get really specific. You can basically provide a snapshot of what you plan to do in therapy with your client. So think of things like modalities, CBT, EMDR, art therapy, play therapy, sand tray therapy, ACT, EFT, etc., etc. You also want to think about skills that you teach. So things like mindfulness training, communication skills training, anger management training, sleep hygiene or working on sleep routines, exposure therapies, psychoeducation on symptoms, psychoeducation on parenting or other topics. So these all provide a snapshot of what you intend to do with your client. Basically, they show that you do have a plan, you know what you're doing as a professional, and you know how to help the client out. But you're not getting as specific as you would in a progress note where it's going to be really specific interventions like challenge cognitive distortions. Now here you can also add any planned coordination of care. So for example, if your client has a psychiatrist and you plan to work with the psychiatrist, if you're working with a child and you plan to talk with the teacher to get information and help the teacher with behavior training things, you want to include that here too. Now let me give you a tip for how to write out the interventions, because this is where I can see a lot of therapists making things overcomplicated. So think about the sentence, therapist will, and leave it at that. So therapist will provide CBT and mindfulness training. Therapist will provide art therapy and play therapy. Period. That's it. The key here is don't include phrases like in order to, or so that. This is where I see therapists then make really convoluted sentences. So anytime things are getting more complex or you find yourself using the phrase so that or in order to, you're probably getting into a whole other section or a whole other sentence. So just think, therapist will do XYZ, therapist will provide, and then it's done. Now here you could even use checkboxes. So you can write therapist will, and then have a list of checkboxes of all those interventions that you provide and check off the ones you plan to use with this particular client. Okay, so the next section you want to have in every treatment plan is client participation. And this is one that I know therapists commonly overlook. But we all know our clients have to do more than just show up for an hour a week and then do absolutely nothing else in order to see real improvement. And most clients plan to do that, right? They want their therapy to be interactive and meaningful. So what does that look like? Obviously, that can look really different for different therapists. You might know already, what do you expect your clients to do in order to improve in therapy? Write some of those things down. But in case you are having some writer's block, I also have some examples for you. So you could use things like complete weekly homework if you're the type of therapist who assigns homework. Or even if you don't do it weekly, just complete homework as assigned. Follow up with reading materials. Practice skills learned in session. That applies 99% of the time. Reflect on topics discussed in sessions. Review progress over time. Share feelings about therapy. So these are all things that implicitly we are expecting our clients to do, but we may not actually voice to them. So including these in the treatment plan makes sure that it's all laid out and everyone knows what's going on. Now, if you're working with kids, you probably want to include family participation here as well. So whomever it is that will be helping the client with their therapy on a week-by-week basis, include those people. So you might use things like practice skills learned in session. Same thing, but maybe with a parenting bent. Track the client's behavior. Offer reinforcement for behaviors, or just offer encouragement. Communicate concerns about therapy. Review progress. And whatever else you commonly have your clients' guardians or involved family do. Okay, now that's it. Honestly, that's all you need to have in a treatment plan, because it covers an idea of what therapy will look like with you and gives really defined goals for what therapy is meant to accomplish. Now, are there other things you could add in a treatment plan? Sure, but do you need to? If you find them helpful, I always say go ahead, add it. But at least now you know what the bare minimum is. And honestly, the bare minimum is good enough most of the time, I promise. Now, you might have one final question, which is, does my client need to sign their treatment plan? Now, this is usually only required with Medicare and sometimes with Medicaid, but it can be helpful to do if you have a group that you're working with. So if you're working with a couple or if you're working with kids and a family. Adding a signature adds a little bit of an extra layer of responsibility and agreement for everyone who's involved. Okay, now you probably want that list of interventions so that you can save yourself some time. Well, guess what? I have it for you. It's available inside the free private practice paperwork crash course. So all you have to do is click below, sign up, head to the treatment planning section, and you will find it right there. No need to think up a ton of examples on your own. So click below to check it out and you can start using it right away.